So I had access to pharmaceutical grade injectable Winstrol Suspension. Worked like a charm, but the post-injection pain, brutal. Vigorous Steve here. Are water-based suspensions actually worth it or not? Well, the crippling post-injection pain really doesn't make these suspensions worth it, but if you can suffer through this post-injection pain in limited practical applications, a testosterone suspension or Trenbolone suspension or Winstrol suspension for that matter might actually be worth it. We're all going to discuss that in this video. And before we do, please like the video, leave a comment for the algorithm, and consider subscribing if you haven't already. Do me a solid and hit the notification bell button so you can get notified whenever a new video drops. I want to limit this video to water-based suspensions only because the carrier oil being used in these Esterless base compound formulations highly inflammatory, so you better stay clear. I'm talking about polyethylene glycol, whether that's 300 or 400. Same for monoethylene glycol, 300 or 400, both highly inflammatory. Glycol, the most inflammatory carrier oil that you can get. It's often mixed with ethyl oleate to make injectable anadrol, and even though injectable anadrol sounds highly appealing, trust me, I've tried. On glycol formulations, whether they contain ethyl oleate or not, your C-reactive protein levels will be to the moon, higher than your liver enzymes. So keep that in mind. Those carrier oils you're better off avoiding, which means you won't have access to an injectable anadrol or an injectable methyl TREN or a injectable check drops I've seen on the market. All of those are suspended in the most inflammatory synthetic carrier oils that are on the market, ethyl oleate included. Now, nowadays, they might be able to suspend that in Migliol, 840 or 812. I believe that some people don't get an inflammatory response to Migliol because it's refined from MCT oil. So that might be a suitable option. Still, it's all underground labs. The only pharmaceutical that are available are water-based testosterone suspension and Winstrol suspension. Everything else is underground lab. And even though they might say that they only use Migliol 840 or 812 in their formulations, you're never really sure if they not secretly put some ethyl oleate or glycol or PEG or MEG in that formula without telling you, right? So personally, I would stay clear. Limit yourself to water-based suspensions. Besides the infection risk, at least you don't get a severe inflammatory response. Let's start with everybody's favorite Trenbolone Suspension. If you thought that Trenbolone acetate made you feel aggressive, Trenbolone Suspension is way worse. That's almost acute. Most people, when they start a Trenbolone acetate cycle, whether that's at a low dose or a moderately effective dose where side effects start to manifest, it might take up to 4 weeks before the aggression really becomes to get severe and you need to dig into your anger management protocols. With Trenbolone Suspension, that's immediate. You inject, you get angry, so you need to inject Trenbolone Suspension right before going to the gym. Anecdotal evidence or reports say that there's some localized site enhancement and muscle growth at the site of administration. So people that really enjoy their Trenbolone Suspension might do that in the body part that they're going to train. Again, 50 milligrams of Trenbolone Suspension seems to be the upper tolerable dose already. I've heard guys inject 200 milligrams Trenbolone Suspension, let's say in their chest, so that's 100 milligrams on the left side and 100 milligrams on the right side. Don't talk with those guys. You need to give them time for the injectable Trenbolone Suspension to wear off, and then maybe afterwards you can approach them, but in most cases they're not. They're severely irritable, severely aggressive. I would advise everybody to stay clear of Trenbolone Suspension unless you're highly experienced with Trenbolone acetate or enanthate or parabolan. You've used a decent amount of TREN in your years. You're competing and you still need to improve lagging body parts. Again, there's nothing like Trenbolone regarding its anti-catabolic effects and its positive effects on body recomposition while you're in a caloric restrictive state and trying to prep to get yourself as lean as possible. In which case, a small top-up of, let's say, 25 milligrams, 50 milligrams Trenbolone once or twice per week per lateral head. So if you're training chest, 25 milligrams, 50 milligrams left, 25 to 50 milligrams Trenbolone Suspension right, once or twice per week to improve lagging body parts even though you're in a caloric restrictive state might be warranted if you're highly experienced, because you need to dilute this Trenbolone suspension with bacteriostatic water or vitamin B12 or injectable carnitine, any solution that is sterile, so preferably a pharmaceutical grade injectable carnitine, or a B12 or B100 or vitamin C or normal saline solution or Hospira bacteriostatic water. You need to dilute your suspensions, which is valid for testosterone suspension and Winstrol suspension as well. But especially with TREN suspension, you need to dilute it quite severely. So if you're injecting 25 milligrams, I would do a 3 milliliter shot, and 50 milligrams, I would do a 5 milliliter shot, simply to allow your body adequate time to absorb the Trenbolone and prevent it from crystallizing in the site of administration, leading to severe, and that's an understatement, I'm talking about severe post-injection pain. You need to administer it right before the workout, let's say 15 minutes, in a voluminous shot. Then you start warming up so all the water and the Trenbolone can disperse, be absorbed, leveling up your workout. Again, you might get some localized effect out of it, but you still need to respect this compound highly. If you thought Trenbolone acetate was strong, injectable, water-based Trenbolone suspension is next level strong. That's the only practical application I see, not for everyday use, maybe once or twice per week at a pretty low dose on top of your Trenbolone acetate during a competition prep. And if you're during the off season and you need a little bit of a boost during a workout on lagging body parts, personally, I would rather look in towards an anadrol or a superdrol absorbed sublingually, maybe 30 minutes, 20 minutes before the workout. That will be just as effective without the anger management issues that come along. Trust me, I've tried to use Trenbolone suspension once or twice per week during the off season, injecting into the chest or the delts. And even with 2 administrations per week at a pretty low dose of 25 milligrams per site, so that's 50 milligrams twice per week, 100 milligrams Trenbolone suspension per week in total, my mood was intolerable, and the post-injection pain, again, made it severely not worth it. I did get good results, though, training those body parts. So, right, it's a huge trade-off, which wasn't a worthy trade-off for me. Testosterone suspension, you can use that in a pre-workout setting as well. Again, the post-injection pain will be there, even if you dilute it with 3 to 5 milliliters of a pharmaceutical dilutant. There might be something to say for the conversion that testosterone suspension gets immediately post-injection. Now, a lot of us are going to use a dihydrotestosterone derivative like primobolan or masterone, or maybe boldenone or dihydroboldenone, which will all prevent the conversion or reduce the conversion of testosterone into estradiol, or use a pharmaceutical aromatase inhibitor in the form of aromacin or arimidex, for example. Still, you're getting such a kick of testosterone suspension that even with a sufficient amount of aromatase enzyme inhibition in place, you will still get estrogen conversion. During the off-season, that's not really a big deal if you limit it to 100 milligrams test suspension once or twice per week on lagging body parts. During a contest prep, it might be more problematic, so I would favor or lean more towards Trenbolone suspension if you can deal with the anger management issues that come along with that. Besides, carb loading. If you really crush your estrogen with letrozole, let's say the last 2 weeks, you megadose the letrozole, you're clinically estrogen deficient, you're on a boatload of drugs, you might be on halotestin or superdrol, and instead of using anadrol to carb load, injectable testosterone suspension might be even better because it converts the estradiol, and now you're restoring a little bit of estradiol the last 2 or 3 days, which should not result in water retention. Again, it's a very fine line to walk. If you've used anadrol in the past to carb load the last 2 or 3 days, for example, you see that you don't hold water in this context, again, because your body fat levels are extremely low. So you don't hold so much water in the skin because all of the mineral retention with the limited duration that you're using anadrol, 2 or 3 days leading into the show, will only result in fullness and mineral retention and glycogen retention within the skeletal muscle. It's the same for testosterone suspension. But the added benefit here is that you're restoring some of the estradiol, because even if you're on a mega dose of letrozole, you still get some conversion. Now, a lot of guys bypass this with subcutaneous testosterone suspension injections, which seems to be less favorable than intramuscular testosterone suspensions once per day. So if you do, upon waking, maybe 100, 200 milligrams, again, these are pretty high dosages because they're bodybuilding competition dosages. So 100 to 200 milligrams testosterone suspension on the morning of your carb ups, that might be beneficial. Then microdosing anadrol, let's say 25 milligrams with meals, or 25 milligrams testosterone suspension subcutaneously multiple times per day. A bolus injection of testosterone suspension during your carb loads really improves fullness, especially if you pull the testosterone out, let's say a couple weeks before, to get your skin as thin as possible. So now you're only on DHT derivatives and Trenbolone and Boldenone. Right? Not the best cocktail, but certainly gets your skin thin. And under those circumstances, I feel that testosterone suspension is highly worth it, because it changes the physique from night to day in the matter of 1 or 2 days. Of course, this is besides the carb loading process and restoring some of the electrolytes, and perhaps loading creatine and other amino acids to really help with fullness. It depends on the level of competition and how much experience the bodybuilder has with their own body. And you can load a ton of different things, one of them being testosterone suspension or anadrol. In that case, it might be highly worth it. But in all of the other contexts, besides maybe a powerlifting meet, I don't think that testosterone suspension is really worth it, considering all of the alternatives that we have at our disposal in the form of oral 17-alpha alkylated anabolic androgenic steroids, which nowadays we know to take sublingually and wash that down with grapefruit juice to prevent the breakdown within the liver on the first pass. And that brings us to Winstrol suspension. Is Winstrol suspension even worth it? Now that we know the context in which Trenbolone suspension and testosterone suspension is worth it. Again, very limited practical applications. I feel that injectable Winstrol suspension is highly worth it, like absolutely worth it, especially at higher dosages. So with injectable Winstrol suspension, more is better, but it also means more post-injection pain, obviously. During a contest prep, in combination with Trenbolone acetate, there's nothing like injectable Winstrol suspension, but only for high-level and very experienced competitors, because with every water-based injectable, the risk of infection is there. Now, I'm not exactly sure if Zambon or Desma injectable Winstrol is even on the market, so maybe you guys can enlighten me in the comment section. I haven't seen it in years. I was very lucky. On my first cycle, I had access to injectable Desma or Zambon suspensions. I can't really remember what the name was, because I think around that time that I did my first cycle, they just underwent the name change. So I had access to pharmaceutical grade injectable Winstrol suspension. Worked like a charm, but the post-injection pain, brutal. Brutal, especially considering I had virgin muscle on my first cycle. So I could barely walk, and I really had to microdose and micromanage these injections, turning them very high voluminous by injecting additional bacteriostatic water with my Winstrol suspension. So keep that in mind. Again, during a contest prep, it's very cumbersome. So besides, if you're already using Trenbolone suspension during your contest prep to preserve or bring up weaker body parts, once you introduce the Winstrol suspension, assuming that it's going to be daily use of 100 milligrams per day, that seems to be the sweet spot for most bodybuilders. You can get away at 50 milligrams per day. But from my experience, 100 milligrams injectable Winstrol suspension per day, that seems to be the physique-changing dose. And I know guys that run upwards of 150 milligrams injectable Winstrol suspension per day and really transform their physique. Now, luckily, you don't have to run it for so long. Similarly to Trenbolone acetate, maybe limiting that to the last 6 weeks or 8 weeks of the competition prep. Injectable Winstrol seems to reach its peak cosmetic benefit within 6 weeks of continuous use. So that's, let's say, 100 milligrams per day or 150 milligrams per day or more, depending on your level of development and how your PED protocol is looking in as a total. A pretty high dose is very beneficial when you're competing at the highest level of competition, a world championship level, a Mr. Universe level, or an IFBB Pro show. A decent dose of injectable Winstrol, very worth it. Worth the risk of infection, worth all of the post-injection pain, which you can mitigate a little bit by diluting the formulation. But I can't say that there's any localized effect of Winstrol suspension, just like you see anecdotally with Trenbolone suspension with occasional use on weaker body part days. What you do see is a severe amount of inflammation. Now, this is not systemic inflammation. This is inflammation within the muscle itself. You see that with Trenbolone suspension, testosterone suspension, but those are for infrequent use. With Winstrol suspension, since you're going to be pinning that every day, or maybe even twice per day if you really want to keep your serum levels as stable as possible, you can bring up a weaker body part simply by injecting it with a high voluminous Winstrol suspension shot over and over and over again. So I've literally transformed people's lats using injectable Winstrol for the last 2 weeks by simply using the lats as the sole injection site and doing maybe 50 milligrams per lat on multiple different sites. These athletes, again, are highly experienced. They practice their posing a lot, so they're able to pose through the post-injection pain, which is going to occur, and the inflammation, which is occurring within their lats. But their lats literally jump a weight class when they're done with this protocol. Again, that's 100% inflammation. Luckily, the lats don't really have any striated muscle like you see with the delts or the quads, for example, which will certainly lose striation if you pin Winstrol in your delts or your legs, right? So stay away from those areas. Winstrol is best for the upper glutes or the lats for that matter, because the upper glutes are hidden, obviously, underneath the posing trunks. And the lats, well, when you're doing a front double bicep, they're just popping. There's no striation present within the lats, maybe here in the abdominals, but not in this lat area, allowing you to pin them repeatedly with Winstrol suspension. Only for highest level of competition where you need a little bit of a boost because the competition level is so high. But just as a fair warning, you will be 100% absolutely miserable doing site enhancement like this. Still, the cosmetic changes of injectable Winstrol are far superior than oral Winstrol, which seems to metabolize in the liver to something that's less anabolic or less androgenic and doesn't give so much of a cosmetic appeal compared to injectable Winstrol, which, again, due to its administration route, has 100% bioavailability, certainly a lot better than oral Winstrol, even when you take oral Winstrol sublingually. All of that aside, make absolutely 100% sure that you have your antibiotics on standby in case of an infection. Keflex and Augmentin are mandatory. Keep those on standby. Find a clinic that can help you in case of an infection so they can drain this pus and all this garbage out of your infection as soon as possible and package it up nicely so you don't have to drop out of your show. Because again, with injectable water-based suspensions, the risk of infection is real, and always looking over your shoulder. So make absolutely sure you practice safe and sterile injection techniques to prevent these infections from occurring. I'll leave it here. Again, the use of suspensions is highly circumstantial, very limited practical applications. It's not something that recreational bodybuilders or even low-level amateur competitors need to experiment with. But if you're competing at the highest level, yeah, there's certainly some practical applications for all three of them. Write your opinion about these comments down below. Vigorous crew, you guys know what to do. A front double bicep for you guys. If you're loaded on suspensions, you wouldn't be able to do this because you'll be bound up so much inflammation on the delts or wherever else you inject it that you're getting pretty much as far as here. So keep some deep tissue massage therapist on standby. Oh, and do yourself a favor, watch this video about cabbage leaves, which is a very easy to use home remedy against post-injection pain. It will certainly work if you have severe PIP after a testosterone suspension, Winstrol suspension, or Trenbolone suspension injection. Many competitors use this technique, but nobody talks about it. There's a video about it. Give it a watch if you're thinking about using any of these suspensions discussed in this video. Thank you guys so much for watching. I'll see you in the next one.